And at this point, I'm happy to introduce John Wilmoth, the Director of the Population Division in the Department of Economic and Social Affairs at the United Nations, who will lead the seminar on population, food security, nutrition, and sustainable development.
Thank you, Cheryl. Welcome to everyone. Good morning, good afternoon, and good evening, as the case may be. Thank you for joining us for this invited session of the 2020 annual meeting of the Population Association of America. As many of you know, the PAA annual meeting for this year was scheduled to take place in Washington, D.C., starting yesterday evening and continuing until this Saturday afternoon. But given the current pandemic, the in-person meeting has, of course, been canceled. The organizers, however, have worked to salvage as much of the original scientific program as possible. And over the next few days, many of the originally scheduled sessions will be held online using virtual platforms like Zoom. So thank you for joining us for this session, which will address the topic of population, food security, nutrition, and sustainable development. This topic was chosen to match the theme of the annual session of the United Nations Commission on Population and Development, which had been scheduled to meet earlier this month, or in fact at the end of March, from March 30th until April 3rd. The original idea of this PAA session was to begin by reporting on the discussion of this topic by governments during the annual session of the Commission, which was supposed to have taken place a few weeks ago. And then that would be followed by a series of reflections from our panel of experts and an open discussion with members of the PAA. The purpose of this and other invited sessions of the PAA that have been organized by the Population Division in recent years is to connect the PAA membership to the discussions of population and development taking place at the United Nations, to ensure that such discussions benefit from the expertise of academic demographers, and lastly, to identify potential collaborators and build partnerships. As most of you are aware, the challenge and eliminating hunger has been a predominant theme in discussions of population growth for more than 200 years. In recent discussions around sustainable development at the United Nations, the food system has been identified as one of the key entry points for the kind of transformative action that will be needed to achieve the sustainable development goals between now and 2030. And thus our original intention with this session was to encourage a broad discussion by the Commission on Population and Development and among members of the PAA of nutrition in the context of sustainable development. But all that was back in 2019. Now, in the new world of 2020, there is much interest in linking this topic to the current crisis of this session without changing the title, but nevertheless modifying the topic by, rather than discussing the topic as indicated in the title, this event will be devoted specifically to a discussion of population, food security, nutrition, and sustainable development in the context of COVID-19. Our discussion today may prove helpful also for the Commission on Population and Development, which is still in the process of deciding how to close out its 2020 session. In 2019, we began working with various partners from across the UN system to prepare the reports to the Secretary General that would inform the Commission's deliberations in 2020. We also held an expert meeting in September of 2019, and all of today's panelists participated in that meeting, where we agreed to emphasize 4 aspects of food security and nutrition that are closely linked to population issues. And that's to say, realizing that food security and nutrition are an enormous topic, we realized that we couldn't discuss every aspect of the topics, and we decided to focus instead on 2 particular issues regarding food security and 2 focusing on nutrition. So a total of 4 topics. The first of those, under the food security side, is the sustainable production and consumption of food, the long-term issues of the balance between population growth and expansion of the food supply, and related issues. And the other issue on the side of food security is the impact of agricultural development and its impact on the food security of populations in living in rural areas, and how that impacts population movements and migration and urbanization. On the side of nutrition, we focused attention on population health and the impact of malnutrition from two different angles. On the one hand, how to address the scourge of undernutrition and hunger, and on the other hand, how to address health problems associated with overweight and obesity. Today, as we seek to adapt the discussion of this topic to the context of COVID-19, we will maintain this four-part structure. Each of our panelists will focus on one of the four aspects just mentioned or on related issues that the world is facing in the current situation. Now, with that introduction, let me introduce our first panelist. Mr. Lorenzo Bellu is at the Food and Agriculture Organization of the United Nations based in Rome. He has been actively involved in the preparations for this year's session of the Commission on Population and Development, especially in preparing the reports of the Secretary General on the Commission's annual theme. Among his various duties at FAO, Lorenzo is the lead author of two recent reports on the future of food and agriculture, which present projections of food production and consumption and help us to understand the challenge of sustainability. At present, Lorenzo is coordinating the collection, dissemination, and analysis of policy decisions regarding COVID-19 for FAO's Food and Agriculture Policy Decision Analysis Database. So at this point, I'm very happy to turn the floor over to Lorenzo.
Okay, now, so the fundamental question that John raised is that will global food and agriculture systems be able to feed the humanity given the fact that there are huge population dynamics and there is a huge additional demand on agricultural commodities, which doesn't come from food, but for other agriculture uses, including energy, fibers, and other raw materials. Now, this is the fundamental scheme themselves, but of course also to FAO and other UN agencies dealing with food and agriculture. Let's start with the fundamental key messages, not to miss them at the end of the presentation. First of all, food and agriculture systems are not sustainable now, and business as usual is no longer an option to be sustainable in the future. So COVID-19 is just one out of many events that could have underlined with a strong emphasis the fact that food and agriculture systems are not sustainable. Are not sustainable because they are not resilient. COVID-19 is showing the lack of resilience of food and agriculture systems. The report of the Secretary of Population Development rightly points out that today there is an increasing recognition of the challenges that unsustainable food and agriculture systems pose on food security, nutrition, and other welfare-related objectives, I would say. This unsustainability is linked, as I said, partly to demographic dynamics, partly to climate change, partly to the sensitivity of access to food to economic downturns. This is just to mention some of the factors that contribute to unsustainable food systems. In the conceptual framework for the current medium-term plan of FAO, we highlighted essentially 10 challenges facing food and agriculture to ensure sustainable food security and nutrition. They are essentially challenges that affect the availability of food, the production of food, and the stability of production. They going from meeting increasing demand, ensuring sustainable natural resource base, addressing the issue of climate change and natural hazards related to climate, preventing transboundary diseases emerging in agriculture and food systems, including, for instance, migration of diseases from wildlife into animal systems, and then through animal systems into humankind. So and all these are challenges that affect the availability of food now and in the future. A second family of challenges are challenges related to access and utilization. What does it mean? It means that challenges to ensure that everybody, all the people, have access to sufficient nutrition, adequate and safe food all year round, and all along their life, from infancy to childhood and to adult age until the end. So, and these challenges are essentially issues related to extreme poverty, huge inequalities, which are not decreasing, inequalities within countries and between countries, lack of purchasing power to buy sufficient food basket, and emerging difficulties to find jobs, particularly for young people, where demographic dynamics are strong. The issue of finding job while production processes are getting increasingly technology and information intense, which means less labor intense, so they provide less job opportunities. On the top of that, the issues of building resilience to shocks like COVID and to protracted crises, including conflict and disaster areas. All this entail addressing some systemic challenges, essentially, which relate to the efficiency, effectiveness, and equitability of food systems. And this implies having in place systems of governance, systems that are able to govern and master, together with the stakeholders, food and agriculture systems. Well, if you look at the food and agriculture systems as such, I put here a graph based on some work done by the Foresight for Food initiative. You see that by definition, you have in a system you have many objects interlinked, and this is essentially the definition of the system. At the core of the food systems, you have the production, processing, retailing, and consuming activities. This is called core. But of course, this core is driven by some drivers, which of course are demographics, consumption and preference dynamics, technological dynamics, climate change, and so on. And these drivers affect the core activities, which in turn entail the generation, entail the production of outcomes which reflect essentially the economic and social well-being of human beings, which are reflected into food and nutrition security indicators, which are reflected into the overall sustainability of food systems. Now, may I say that the core of the food systems have been investigated and have been the object of policy making and the object of even the UN system for quite a long period of time, together with some drivers like demographics and development, as John said in the introduction. What is a bit more neglected is all what relates the relationship between food systems and the other systems. If you look at why I'm saying that these issues are neglected, because if you observe the loss of biodiversity, for instance, related to food production and related in general to the production activities of humankind, if you look at greenhouse gas emissions, if you look at land use and land degradation, together with the issues of antimicrobial resistance entailed by livestock activities, which in turn affect the spread of diseases, animal and human diseases, including COVID-19. Well, these are the neglected aspects, which essentially refer to the interactions of food systems with other systems. The report of the Secretary General, the first report of the Secretary General of the Commission on Population and Development, tries to address some of these interlinkages and to spell them out and opening some perspectives for policy making on that. Of course, the COVID-19 came at the point where it was clear that we had to fix our food systems to increase their resilience and sustainability. COVID-19 disrupts food systems in different dimensions. Consumption patterns, for instance, what is the purchasing power of people in precarious job conditions? You know, I can't exhaust all the list of domains where food systems are disrupted by COVID-19. Just think about precarious workers. You know, they don't get income anymore. They cannot buy food. Logistics, how to access markets for smallholders, not only, but how to distribute food in urban areas. Retailing, you know, how people segregated can access food if nobody is bringing food to them. And the processing of food, which occurs where workers are nearby one to the other, the proximity of workers in food processing. This is a big issue. How to isolate, how to introduce a physical separation in order to stop the spread of the coronavirus. Issue of migrations, you know, how to people normally migrating, how can they move around to satisfy the demand of work, the labor demand for harvesting, for instance. And this is a big issue. And you can see that. And then you have overlapping crises where COVID-19 composes with other crises in conflict areas. You know, so I refer you to the references I put here to know more about the impact of COVID-19 on food systems. But I want just to underline the fact that if you want to understand effect in the future food and agriculture systems, you have to think in terms of dependencies, cross-dependencies, and interlinkages. This is a lens through which you can understand much more of the impact of COVID-19. So, for instance, when I talked about neglected focus on interdependencies, I mean, in many instances that we neglected the fact that if people don't have purchasing power, they cannot buy food. If they don't have jobs, they cannot buy food. So we kept, for instance, promoting the mechanization of agriculture. I'm not sure that we have the full picture of what this entails for job losses and the extent to which these jobs could be recovered in other sectors. You know, while other sectors are also undergoing a transformation through mechanization and information density, which rules out part of the job demand. Cultural dependencies. In the report of the Secretary General, it is highlighted that prevailing Western and Europe and Northern America diets are going to be spread by imitation into other continents. Of course, with all the problems that we have in terms of diseases, non-transmissible diseases, diabetes, obesity, and so on. Cross-country interdependencies in terms of income distribution across countries, the technological dependency of some countries from other countries, in particular, dependency on oligopolistic markets for big data platforms, which are increasingly used in a COVID-19 era. You know, well, what about the future? FAO designed 3 scenarios, going from business as usual to sustainable scenarios and including an increasing inequality one. Well, as the Secretary General report highlights, for instance, for food security, we're moving along the worst case scenario, and COVID-19 will probably contribute along this pattern to worsen the situation of food security and nutrition. How long it's going to last, nobody knows. How far this is going to hit, nobody knows. Just to say that the official figures of Nigeria for the time being point out to few hundred infections, while the official figures of Ethiopia are almost close to zero. Is this a realistic picture? I'm not sure. We have to be careful and shape policies in order to address these emergencies. I stop here and I give the floor back to the organization.
Thank you, Lorenzo. That was very interesting. A lot of introduction to the topic. And so I'd like to turn next to our next panelist is Ms. Nomokolo Kovic from the International Food Policy Research Institute, or IFPRI, based in Addis Ababa, but currently, I believe, elsewhere on the African continent. With a dual background in agriculture and nutrition, Nomokolo's work straddles the interface between policy, nutrition action, and implementation challenges. Since 2011, she has worked closely with the African Union on different aspects of mainstreaming nutrition in the Comprehensive Africa Agriculture Development Program. Her recent efforts have centered on strengthening the capacity of national stakeholders to deliver positive nutrition outcomes from a food system perspective. She frequently contributes to national policy and technical dialogues with different African countries and provides an African perspective in global dialogues seeking to improve food security and nutrition. Today, we will hear her perspective on impacts of the pandemic on populations that were already struggling to ensure adequate nutrition for all. Nomokolo, you have the floor.
Good morning, good afternoon. Can you hear me?
Yes.
Thank you. Now, I will focus on the impact of hunger on malnutrition with an African perspective, but also touching on some aspects on the global level. And then as I look at the impact of hunger, I will then reflect on what the implications might be for the COVID-19 pandemic that we are now facing. I want to start first by saying many of the global population are still hungry. And as this graph from the State of Food Security report from FAO reflects, the numbers of the hungry has remained relatively stubborn for Africa and Asia. And in Africa, since 2015, you can see that we were already seeing an upswing in the number of people that are undernourished. And then COVID-19 has arrived at such a situation to make the situation much worse. So we expect hunger to worsen, and we are already seeing some indications that this is going to be the case with respect to the disruptions that the lockdowns that have gone into place to mitigate the situation have brought about. On the status of nutrition, we have seen slow progress on undernutrition, but at the same time, we've seen much faster movement towards increasing overweight and obesity. And so we see these kind of really frustrating statistics of 100 million children being too short for their age or stunted, 51 million children being really weighing too little for their height, and therefore being wasted or suffering from acute malnutrition, which is usually quite dangerous, and really they face a very high risk of death. Then already we'd see 38 million children worldwide overweight and 2 billion adults overweight and obese. And for the Global Nutrition Report of 2018, over 124 countries that were assessed, those that were analyzed, 124 out of 141, were really facing multiple burdens of these forms of malnutrition. And regardless of whether the population is suffering from undernutrition or suffering from overweight and obesity, hidden hunger or micronutrient deficiencies are rampant. Now, each one of these brings a health burden to the population, which African countries are already not able to cope with. When we look at the related food security challenges, taking examples of maize and rice as major, see that the balance of trade is really in favor of more and more coming from imports and less from what is being produced in the country. This creates a significant problem in terms of risk to food security coming from trade restrictions that we are beginning to see with respect to COVID-19. And for wheat, the situation is even worse because we are producing much less wheat on the continent. Of course, the situation is different in different countries, but in general, because of the dependency on trade, bringing in staple foods onto the continent, with the trade restrictions that are coming into play now, the situation that COVID-19 then presents us is one of increasing food security challenges. I want with this slide to refer to the Eat Lancet Commission report on a diet that would support both human health and the health of the planet, and use North America here as an example to show how on a lot of the food groups we should be consuming, we are really off the charts in terms of not just beyond planetary boundaries, but also beyond what we should be consuming for our normal health. This brings a burden to the health system. Now, very clearly already from those in Europe, in the US, in China, it is very clear that comorbidities of non-communicable diseases are high-risk factors to poor outcomes to COVID-19. And yet we are beginning to see increases in these as well in developing countries and certainly in Africa. If we look at sub-Saharan Africa against the Lancet recommendations, what we find is that for the most part, we are still below the health boundaries. So in terms of population health, we are not consuming enough of a number of the nutrient-dense foods. Red meat here looks as if we are consuming adequate amounts, but like I said earlier, we need to take into account differences across countries. But the issue isn't enough to eat, especially of the more nutrient-dense foods that are also important for immunity to disease. And COVID has arrived at a situation where people's immune systems would already be compromised from undernutrition, but also that they may be having problems of non-communicable diseases that the health systems are actually not able to address at the moment. And for Asia, we can see that the situation is not very different from Africa, except there are differences in terms of which food groups are more dominantly consumed. But in general, what we're looking at is a situation where areas where consumption of nutrient-dense foods are low, are also the areas where we have poor health systems, and therefore coping with the COVID-19 pandemic will also be compromised. Now, we already know that undernutrition is very costly to countries. And this is work that was done by the African Union with WFP some time back, showing that the cost of undernutrition in terms of health, school, and other costs could range anywhere from 3.1% to 16.5% for Ethiopia in terms of GDP. Now, those are significant amounts of money to lose on government budgets that are already constrained. And what COVID-19 has done is bring an additional burden into this context. And then this is undernutrition. But if we start thinking in terms of overweight, obesity, and the related non-communicable diseases, those two come with additional health budgets. And we know already that more people die from conditions like diabetes and heart disease than in developed countries, simply because of lower, poorer health systems. And then we have then our aspirations to improve our food security. And our aspirations are towards intensification of agriculture production, and for crop agriculture, that is stronger movement towards monoculture and use of fertilizers and pesticides, which themselves come with additional risks from residues that our systems are not equipped to deal with. Since we have inadequate policy and regulatory instruments to actually monitor what is happening and to mitigate the situation, in addition to that related to damaging the environment. The same is the case for the livestock production. We are aspiring towards intensification of agriculture production, and this is coming with it increased use of antimicrobials and pesticides to control disease. So the question is, where will the next COVID-19 actually come from? And if we were to face similar challenges like this, we are actually ill-equipped to deal with the situation because our policy and regulatory instruments are actually not yet in place. There are efforts currently through the African Union to try and develop, actually it has already been developed and launched, a food safety index that focuses on systems development to try and address the issues. And then COVID, of course, is with us, and this is the statistics as of yesterday. We have reported more than 25,000 COVID-19 cases. This morning when I checked, the number has already gone up to 26,000. And what you are seeing there with South Africa, that's the country, according to CDC Africa, at the African Union, South Africa is the one that seems to be best equipped, that is testing the most. And even here we are seeing that it's not clear where things are actually going to go. But the situation nonetheless is with us, and African countries across the board have tried to mitigate, and many have put in place locked down measures to try and contain the spread of the virus. And then, of course, we know that the most effective way of addressing COVID-19 is washing hygiene. But this is an intervention that we need in places where potable water is not even available. And therefore, this requires to think really out of the box, to think about what can we do to address the situation within these contexts. And then, of course, there's the issues of physical distancing. And I'm showing you examples here based on Ethiopia. Ethiopia actually is now reporting 116 cases as I checked this morning. You look populated peri-urban areas. The question is, governments have said social the point I was trying to make is the fact that we have very densely populated urban settings where physical distancing is difficult. And yet, those are some of the measures that we need to put in place for us to help contain the COVID-19 situation. And then our food systems are quite dominated by an informal food sector that we need to put in place are difficult. So the issue then is, what is relevant in different contexts across the continent to try and find ways in which we can mitigate within the constraints that we are now facing. And this will really require looking at one country at a time, one neighborhood at a time, to find the right ways forward. I would like to finish off with the following key messages on the impact of hunger and food security with respect to COVID-19. The fact that malnutrition in all its forms is a real health risk to the population on the African continent. We already have issues around food safety that we don't really understand that well, in terms of the burden of disease that is coming from there, but we know for sure that there are problems. And then we are all seeing increasing overweight and obesity and non-communicable diseases. Those two come with a problem in terms of health burden to health systems that are already not coping. And it's these health systems that now COVID-19 has come to, and the likelihood that we will be able to cope in an environment where even developed countries like the United States, Italy, the UK have struggled is actually, to me, it scares me. But all the more reasons, because some people have been critical about the lockdowns that African countries have put in place at low case levels. But the issue is recognizing the fact that our health systems actually are already not coping. And so countries grappled to try and lock down their economies quickly in the hope that we would be able to contain the situation. Is there anything that we can do different? I think we are learning as the situation goes by, and it really remains to be seen what is going to work. But what is important, I think, is to keep sharing information as the situation evolves, so that where things seem to be working, others can actually have preview to that information, so that we can try to keep trying to mitigate as we go along to try and address the situation. Thank you.
Thank you, Namakolo. Yes, the scenario you described for Africa, of course, is a cause of concern to many of us. What will happen there with the pandemic, and I think it's very good that countries are taking action very early. Obviously, we know that makes a big difference. The timing of when the stay-at-home orders start makes a big difference. So we turn our attention now to the third speaker. Our next panelist is Mr. Alan Dubrow. Like Namakolo, Alan is affiliated with the International Food Policy Research Institute, or IFPRI. Alan is based in Washington, D.C. And his research has focused on understanding impacts of agricultural interventions, including those working to improve nutritional status among beneficiaries, also on the role of women in the rural economy of developing countries, and the effects of migration on households and communities of origin. He will share with us today some reflections on the relationship between migration and food security, including with regard to the COVID-19 pandemic. Alan, you have the floor.
So I want to talk first about voluntary, what I'm going to define as voluntary migration. So migration that people do to receive higher wages or the like. And I want to talk about that type of migration, and first what I'm going to call modern food systems, and then go to traditional food systems. There are obviously a lot of food systems or countries with food systems that are in between the two, but it's important to it's a good delineation of the types of food systems that we're talking about. And I want to speak a little bit about involuntary migration, meaning IDP or refugee situations and the potential impacts of COVID there. Before I go too far, I want to say that it's a lot of what I'm going to say is not as rooted in evidence as we like to be at IFPRI. So I just want to give that warning, and I'll try to state when I know something a little bit better than when I don't know it. So first of all, migrants play a key role in European and North American food systems. These food systems are characterized by very long value chains, with food flowing from farm to supermarket. They're often integrated with the world economy, and migrants play really key roles in a lot of these economies, and we've started to realize that very cogently in the last few weeks. Migrants work in slaughterhouses. They pick some perishable crops, although there are some perishable crops that are now like the mechanized tomato harvester can pick tomatoes. And they work a lot in food distribution, particularly in food consumed away from home. So how does COVID-19 potentially affect food systems from this migrant lens? Well, we've already started to see challenges within specific value chains, and I think we have good evidence here that these value chains are really affected by the slaughterhouses being closed for outbreaks. There's a lot of concentration in some of these markets as well. That concentration means that if there are these closings, you end up with a big gap between farm gate prices and prices or shortages at supermarkets. So we've seen that in the US. A lot of prices are at 52-week lows right now, whereas for goods that we can't find in supermarkets. At the same time, we know that we're going to need to depend on migrants for particular tasks in the future. Right now it's asparagus season in the US and North America, and a quote from a French farmer is that the French are very bad at picking asparagus, that she can't find enough. This article noted she couldn't find enough of her normal workers. We also know that Americans and Western Europeans don't take jobs on farms picking crops. Specifically, I'm thinking of an unemployment program in North Carolina that tried to pick up American workers. They hire thousands of migrants every year and could only find 7. This is a few years ago. Second thing we're going to see is a massive change in the structure of food demand, and I don't think we know what that's going to look like. But we can hint. One hint comes from the food away from home that has become a big part of the food budget in developed countries in recent years, and it's going to substantially change. I want to argue that it's likely going to be changed for a really long time as well. Just looking at some data from the BLS, which is an American survey, we see that the food away from home made up 44% on average of Americans' budgets in 2006. We, of course, had a recession, 2008 through 2010. It dropped actually below 40% before recovering only in 2016. So this is obviously an even bigger shock than the Great Recession that took place. This is going to be global, and I think that's going to change the structure of food demand. One thing we've seen here in the U.S. is that structure actually matters quite a lot. Different meat cuts have different prices right now, and we're seeing a lot of upheaval And we're going to continue to see that upheaval as time goes on. Since migrants work a lot in these markets, we're gonna see a change in the structure of migrant labor demand as well. So some thoughts about potential policy responses. Well, one thing is for sure, we need policies that can ensure guest workers can continue to enter markets in the OECD countries. A second thing that's really key is going to be to keep international agricultural trade moving. And we see that from both the developed country perspective, where we have a lot of international agricultural trade in our food basket, but also, as Namkulo mentioned, in Africa, with the staple grains being net deficit, without that food trade, we could see a lot of problems with hunger. And I think we need to quickly think through how firms in the middle of the value chain can be cognizant of risks to their workers, particularly in food packing and food distribution channels. Without that, we could really see a lot of problems in food supply. Okay, let's move to traditional food systems. A major reason that migrants leave rural areas is that wages are higher in the destination than at the source. Economists have been doing work on this for more than 50 years. It's very kind of clear, both rural-urban migration and international migration work this way. So as migrants move to urban areas, or whether in domestic or international destinations, urban areas often end up with these similar long value chains to modern food systems. So we see the transformation, I'm going to argue, is catalyzed by migrant movements. We know that diets of migrants improve nutritionally as well. So we have good evidence from Ethiopia, Tanzania, that that's the case. And these higher incomes of migrants in rural areas also help improve diets through remittances in those rural areas. It also may increase the consumption of processed foods. So we have to be careful about that. So what happens with traditional food systems when we add a pandemic? Well, if you have no jobs in urban areas, then the Harrison-Tadaro logic is obviously breaking down, and then no job means it's difficult to also acquire food because you have no money to exchange for that food. And as a result, we have reports of international migrants returning home. Picture on the right is of migrants leaving at the Thai-Myanmar border, returning to Myanmar. But these are reports. We don't have, and it's going to be easier to have international data than data within specific national contexts on this point right now. And we should be concerned about food and nutrition security among the migrants who are still in urban areas, migrant families, and those who are returning as well, because it adds to the denominator in the household food budget. So some questions we need to know answers to are: how many migrants are returning home? Well, we are, at least at IFPRI, planning a few phone surveys to help measure this, specifically this urban to rural return, but it's going to require some research investment and quick thinking about how to really understand how big that is. Is everybody moving back to urban? Is everybody moving back to rural areas, or are only a few? How big is the flow across international borders? I think answering those questions can help us understand how big responses need to be. Secondly, it's important to understand that financial flows, make sure financial flows get out to rural areas to help nutritious food to continue being produced. Vietnam has been really good about that as a particular example of one country. But a point here is that a large proportion of rural residents actually lack formal bank access. So it's not as simple as getting money to those people. We need to also we can't just use banks. Mobile money could be a potential way to do that, as people have cell phones now. Okay, a couple points on involuntary migration. There's already an endogenous relationship here with food insecurity. And it may be difficult to leave or get into IDP or refugee camps as a result of COVID, and the U.S. government is not helping any of this right now. Protracted crises are also an even more difficult problem, since there's already donor fatigue related to those, and it's more difficult to it may become more difficult to integrate IDP or refugee camp residents into local economies as a result of COVID. Actually, I wouldn't say maybe, it is. And some camps are so crowded that the density is much higher than even in New York City. So an outbreak could really exacerbate tension with local residents. I think my point in bringing all of these points up is really that we need to be cognizant of them, and try our best to understand how how easy they are to neglect, given that governments are closed and the like. These issues are all difficult to address, and the UN really, in particular, has an important role to play in trying to make sure that they continue being highlighted. Lastly, I want to talk quickly, is mobility forever going to be changed? I actually tried looking up some information from the Spanish flu on this yesterday, like how long will it take? Some jobs, as I've argued, are going to be harder to see a return. Particularly as we start to recover in a few, hopefully soon. It's more likely that food demand patterns will change, and hopefully the global response will not reduce the gains that we've seen to nutritional status that have been attained this century. Thank you.
Thank you, Alan. That was very interesting. I had to unmute myself. That was very interesting and helps us to see the ties to patterns of human mobility, which obviously is a very important part of the whole discussion of the food system. The role of migrant workers is very important. And the epidemic also has set in motion many people, has set many people in motion who've been moving, as you showed, as a result, which has implications for many things. Our fourth and last panelist is Miss Rachel Snow. Rachel is well known to PAA members, having worked for many years as an academic demographer, first at Harvard and later at the University of Michigan. In 2013, she was the lead author of the massive assessment of progress made in the first 20 years following the Cairo Conference on Population and Development, which took place in 1994. For this year's session of the Commission on Population and Development, Rachel led the preparation of one of the reports of the Secretary General, specifically one on programs and interventions. I believe she will be discussing the impacts of overweight and obesity. In fact, I asked her to focus on global trends in obesity and exploring the ways that these issues may be influenced by the current pandemic. Rachel, you have the floor.
Okay, thank you very much, John. Also, thank you, Cheryl, and good day to all the colleagues globally. Indeed, John asked me to focus these comments this morning largely on the obesity and overweight trends, and I'll do so, and I'll link a little back to COVID-19 on a couple of major points. In some respects, my comments here, they echo messages that I think particularly Namukolo has drawn our attention to. So let me focus here on just a few key sort of staggering messages. If you look at this particular slide, this is an FAO product here. Look at the bottom one. Namukolo mentioned 2 billion.
Rachel,
yes.
May I interrupt for a moment? We don't see your slides yet. You'll need to share your screen.
Oh, I beg your pardon. Okay. Okay, great. And I just want to draw attention to this at the bottom of this particular slide, 2 billion. And just kind of put that into a perspective, we're talking about 2 of 5 adults worldwide are now overweight. And, you know, the scale of that, we of course, you look back to 1975 and we saw obesity already rising in wealthy countries. Then there's been this progression into the urban areas of poorer countries, but we are now looking really at a global epidemic. Okay, sorry, I'm struggling a little bit with how to move this. Okay. In particular, if you look at, these are children, this is children under 5 and the proportion that are overweight. And while indeed, again, just to reiterate the last point, there's a very serious problem in North America, South America, East Asia, absolutely. But notably, it's in North Africa and Southern Africa where we're now seeing 1 in 10 children under 5 are overweight. So again, this is uneven across the world, but this is no longer by any stretch a situation that is largely affecting wealthier countries. The contributing factors, many of which are outlined in the Secretary General's reports, are, of course, the rise in income in lower and middle income countries, which has been a positive for so many aspects of development, and that has led to this greater demand for nutrient-rich foods, but in parallel and more rapidly, a rise in the consumption of processed foods and beverages. And in large measure, this seems to be very much about the greater affordability, extreme marketing and availability of high processed, energy dense and low nutrient foods. This is just one figure. It's from 2000 to 2013. This is 13 Latin American countries. And all it's showing you here is the trends in the retail sales per capita of ultra-processed food and beverages. So the black line is Latin America broadly, and then you see that this seems to be consistent with greater degrees, of course, in one country or another, but this is very much a global phenomenon. And I think notable to the COVID-19 discussion here is this interesting paradox of poverty and obesity. And in part, what seems to be the case here is that when households and individuals experience food insecurity, either even mild and intermittent, that's associated with the consumption of indeed what are more affordable, but the energy dense but nutrient poor foods. And so we have this interesting phenomena. I thought Namakolo identified it really well, this phenomena of the kind of double and triple phenomena where you have communities and households with, at the same time, child wasting and stunting and micronutrient deficiencies. At the same time, in same household, you have overweight and obesity, and both overweight and deficiency co-occurring. So just, and as the food systems, if they are indeed seriously disrupted and we see a considerable rise in food insecurity because of COVID-19, just ominous concerns about what that's going to indeed lead to, again, people moving towards foods that are more affordable, but may be less dense in terms of nutrients. The health impact, again, I've tried to make this really short because I know we want to get to discussion. It's now estimated at about 8% of the global deaths are attributable to being overweight or obese. And unhealthy diets are now responsible for more adult deaths and disability globally than tobacco use even. Because I'm speaking to you from the UNFPA, I need to mention, of course, sexual and reproductive health here, and just to underscore the point that as obese women become pregnant, they have elevated risks to their own health, worse pregnancy outcomes, and their offspring have higher risks of adult obesity. And the consequences for children who are obese, going back to that 40 million number of children under 5 who are already overweight, you see problems with breathing, greater problems with psychological challenges, discrimination challenges, a range of, and then much earlier onset of type 2 diabetes, and etc. Breastfeeding reduces the risk of being overweight and obesity, and for women's health, it reduces other issues, but we still only see across the world 2 in 5 infants are exclusively breastfed for the 6 months that are recommended by the WHO. Again, will that change in the context of COVID-19 and greater dependency on what's available at the household? We'll to be seen. When we think about what works, let me just preface this comment by the fact that no country is apparently, from what we saw in the ESG reports, not a single country is currently on track to meet the WHO's 2013 target of halting the rise in adult obesity. So there's been some plateauing. It appears to be moving in this direction, but as yet we don't see a great deal of really definitive progress. WHO has a list of best buys for the cost effectiveness interventions, and there's a long range. That said, we've seen much better in looking at the interventions, much better evidence of what works in terms of addressing malnutrition, very, very extensive and good evidence on interventions for school feeding, interventions for making sure that maternal infant diet is well nourished. And we're really in new territory and trying very hard to identify what systematically works at scale to reduce the risks of overweight and obesity, but we're in new territory. So this list is a really critical list. Within that, we see some evidence I think the UK has, some of the strongest evidence that the taxation on sugar-sweetened beverages have some impact. There is also some evidence, particularly from the US, that vouchers for fruits and vegetables are helping. But there's also evidence that food-based dietary regulations are indeed very useful. But I would point out from the UN's perspective, those are only evident in 91 of the 193 member states and only 7 countries of Africa. Last slide. I think it's already been underscored here that malnourishment, whether that is undernutrition or obesity, are already associated with more severe COVID-19 symptoms, and particularly the requirement for hospitalizations. The obesity link to here was initially assumed to be the obesity link to comorbidities. So more obesity, more type 2 diabetes, and hypertension. And hence, that's why obese individuals seem to have more severe COVID-19 symptoms. But I just want to alert everyone to the very recent evidence that's emerging that obesity appears to have some independent effect. That's the best data are coming out right now from the CDC in terms of what I've seen globally, where we're seeing a very high risk of severe COVID response among severely obese young people who have none of the identified comorbidities. And so this independent effect, there's both speculation about some functional issues with respect to pulmonary function, but also some questions about obese adipose tissue itself. So I'm going to stop there, and hopefully we can move us to discussion. And thank you very much. Over to you,
Thank you,
John.
Rachel. That was very interesting. The last discussion about obesity, the direct impacts of obesity on COVID mortality. I hadn't heard that. So we are going to open it up for questions now. We have about 20 minutes. We'll try to take, questions from the audience or comments for the next 15 minutes at least, and then try to save 5 minutes for final reflections by the speakers if there's time. So I see that Monica Dasgupta would like to speak. Monica, you have the floor.
Okay, thank you. These were just terrific presentations. I learned a lot, and I hope people will be able to share the slides later on. I would like to draw attention to a low-hanging fruit that could receive more attention in this whole discussion of malnutrition and also of the current COVID outbreak. And that is communicable disease control to improve population health. There's enormous volumes of evidence from the 1950s onwards that when children are subject to repeated infections, they become stunted and malnourished. It's a huge drain on their system. So even if they're taking in enough food, they're not able to grow. There's just vast volumes of evidence on that. And there's other kinds of evidence, like Sam Preston had this wonderful data set from the 1940s on nutrition intake and life expectancy. And what you see is that Japan, South Korea, and India all had similar, very low levels of nutritional intake per capita. But Japan and South Korea, with their better public health systems, had about 10 years higher life expectancy. So there's a great deal that can be done through infection control to improve nutrition outcomes for people who suffer from low levels of nutrition. And the second point, again, with public health systems, is that we really need to be much more proactive, not just recognize the problem of practices in livestock production and retail that cause repeatedly outbreaks. COVID-19 is just one of them. We're well aware of it, but we don't somehow make the connection between that and having a really good public health system in place that oversees these practices. Just as we take it for granted that a public health system will oversee food hygiene in the retail of cooked food, which can be achieved by improving population-based health systems, not just medical systems, but systems that seek to improve the health of the population as a whole, which are really very inexpensive in comparison to other interventions and face very little pushback from political forces or, lack of interest in protecting common property resources and so on. Thank you very much for giving me the opportunity, John.
Thank you, Monica. I think those were both very good points. I see Walter Higgins trying to take the floor. I will unmute you, sir.
Hi.
There you go.
Hi, everyone. My name is Walker Higgins. I'm with Columbia University. Thank you for the presentation. It was really informative and helpful. My question, my first question, I suppose, is related directly to COVID-19. With a number of reports and studies, such as the Lancet report, researchers have identified sort of transformational changes that are needed to maintain planetary health and global public health. But in this moment of crisis, to what extent are we still planning to address those, or are we sort of dropping everything and focusing on sort of the acute, immediate needs being, caused by this global pandemic? Or, to what extent, from a planning perspective, are we able to walk and chew gum at the same time? 10 of the panelists.
Yes, that's a very good point. Of course, we also know that some of the long-term sustainability issues have been mitigated to some degree. I mean, at least in the short term, the consumption of fossil fuels. Know that this has all come down because of the pandemic. But your question is very appropriate. Are we addressing the long-term issue? Are we still continuing to focus on the long-term issues when the short-term issues are coming up? I'm going to take one more comment, and then we'll maybe bring it back to the panelists for responses to any of these. I see Mauli Sabla raising his hand. I'm going to unmute you. There you go, Mauli.
Thank you very much. And let me thank all the presenters for the very interesting presentation. So my name is Mauli Sabla, working with UNICEF headquarters. I just wanted to ask some of the presenters, especially maybe Lorenzo can respond to this. There are observations that with the lockdown and some of the current slowdown of human activity is indicating some positive impact on climate with improved air quality, reduction in emission rates. Do you think that this could also serve as an opportunity for us to not go back to do business as usual, but to see this current pandemic as an opportunity to see how we do things differently to address both climate challenges whilst also improving food security and nutrition. And then the second question which I have with regards to the Namukolo's point on how micronutrient deficiency is affecting all populations across the world, whether we are in developed countries where we see more overweight and obesity compared to even underdeveloped, more low middle income countries where we have higher levels or the multi overweight, obesity, and undernutrition. How do we leverage the private sector to ensure that even within these times where we have lower levels of dietary diversification, how do we leverage the private sector to advance food fortification with essential micronutrients, for example, so that we can ensure that as people move towards lower diversity and are dependent more on some level of processing, the private sector would be able to add essential micronutrients to certain staples or promote biofortification. So these are my two comments. Very interesting presentations. Thank you very much.
Okay, thank you very much, Mawuli. I think with those three questions, and I don't see anyone else raising their hand right away, so I will maybe take this back to the panelists if you would like to respond to any of the questions from Monica or Walker or Mawuli. Any takers?
John, hold on, I need to unmute everyone.
Yeah, okay, I see.
Sorry.
Lorenzo has his hand up. I'm unmuting Lorenzo. I thought I had. There we go. No.
It takes a second.
Thank you.
Okay.
I'm unmuted now. Okay.
Yes, you are.
Yes. Thanks very much for the comments, Mawuli and the other colleagues. As a matter of fact, we have two options in front of us. So. First of all, the temptation is, okay, let's do more of the same. When you are in a period of crisis, you tend to look at food where food it is. So, and this is normal. So, but then the crisis, hopefully the crisis will leave us in, I don't know, 3 months time, 6 months time. It's difficult to guess, but at a given point, we will have time to think more of what went wrong, and what went wrong. I hope that we will be able to take stock of lessons, So first of all, long value chains, starting in Brazil, ending up in China, is this the type of value chains, particularly related to essential items like food, that are resilient enough to face situations like outbreak of a pandemic, So a second question is, what is the role of the public? In Europe, we have cases where some countries, including Italy, for instance, have progressively dismantled public health care to the advantage of private health care, that private health care didn't have any interest in having intensive care, because intensive care doesn't pay off, so it costs a lot and it doesn't bring money. So, and this progressively intensive care has been dismantled, so which means that when the outbreak came, Italy didn't manage to react because we didn't have enough health intensive care beds for people, So all in all, we can think in terms of food stocks, So there has been a tendency to decrease strategic food stocks because people said this is not efficient. You can rely on markets, but of course you can rely on markets as long as logistics works and as long as people are willing to sell. So we have to learn. Now we are in a crisis, and people tend to say, okay, let's keep going with markets providing food, and let's get food where food is, out of this COVID-19. These are not new things. These are things that we kept discussing for quite a while. And if you browse FAO reports, and not only FAO, but also World Resources Institute, IPCC reports, and so on, all pointed on lack of resilience of our food and agriculture systems. And of course, now we're paying the price for lack of resilience. I believe that we have to go back and drawing lessons out of that.
Thank you, Lorenzo. These are all very good points. I'd like to call next on Namokolo, who I think will respond to some of the comments.
Yes. First, I think to respond to Mauli's question on leveraging the private sector. I think it depends on the context, and one of the things I think we need to realize, at least across Africa, country contexts are actually quite different. So in South Africa, it'll be very easy to leverage the private sector to bring in micronutrients, let's say in staples, which they already do. South Africa fortifies both bread and maize flour with 11 micronutrients, and they've been doing this since 2003. So it's quite extensive. But that was very easy because there are 4 big companies that are doing it. So you speak to 4 CEOs and you are done. If you look at a situation like Zambia, then you are dealing with millions of small hammer mills producing maize flour, which is the major staple. Then how you do it becomes a bit more difficult. Having said that, fortification is really something that we should look at as a way of mitigating against COVID-19 situations, even if it is home fortification. The reason is because we know micronutrients such as vitamin A are associated with stronger immune responses. So you want to be able to at least address micronutrients that you can. The other thing is fresh food supplies are likely to suffer quite a bit because the movements, a lot of the fresh food in Africa coming from the rural areas into the urban centers don't come in big trucks. They come on top of minibuses carrying passengers, and these are some of the areas that are being restricted now. So movement of fresh produce is going to be limited. And while that is limited, micronutrient supplementation might help us in the short term. Then the issue for me is the issue of long value chains and what have you. I think we also need to remember how COVID-19 came to us. It's really wet markets. And when we focus only on long value chains, we lose sight of the fact that even some of the shorter value chains that we have, where we are buying live animals and slaughtering them in place and what have you, that those actually present food safety challenges that need to be addressed. And we mustn't lose sight of that. And so for me, bringing the COVID-19 situation into the African continent, there are many places where we are doing similar type of slaughtering in markets where people will come and buy fresh produce, in part because we don't have cold value chain and people tend to want to go and buy their food freshly slaughtered, take it home, eat it immediately. So from a food safety perspective, I think there are a lot of things that we can do that I hope we will benefit from the COVID situation in terms of what we need to be careful about in terms of how we conduct the issues around animal source food, but also look to the same animal source food consumption. I think is going to go down. I don't know what the numbers look like now, but there's likelihood to be a reduction in consumption as people start thinking, well, maybe we shouldn't be eating so much meat after all. But if that happens, then it would have been a positive thing with respect to the Lancet recommendations. So I think that also needs to be kept in sight. Thank you.
Thank you, Namakolo. I'd like to turn now to Rachel. She wants to make some concluding remarks, and then Alan will speak.
Okay, thank you very much indeed. I just want first to underscore the point Monica was driving at, that in our report we're looking at interventions, of course, and what becomes so clear is that the scientific research community since the 70s has really done an extraordinary job in documenting the relationship between nutrition and immunity. And it's startling to see how many very well-proven interventions for improving nutrition, hence immunity among pregnant women, among children, are there. We know exactly what to do, and we simply need the will and the money to do it. So this is not a place where we are under-informed about what works. But with respect to COVID, again, because this is the PAA and there are a lot of public health scientists in the room, I just want to point out that we need really a huge push for disaggregation of COVID data. Of course, we need more testing, but we just looked with the WHO yesterday morning, and half of the European case reporting isn't even being disaggregated in any detail by age and sex, let alone comorbid conditions. So it's an opportunity globally for us to be much more sophisticated in the way that we're undertaking surveillance and reporting, so that we can learn as much as possible and then indeed respond effectively.
Thank you, Rachel. And I think we'll go for final comments to Alan.
Thank you. I just wanted to make two quick comments that that came up as part of the response. First, it strikes me that we're going to have a very different food system in 6 months, 12 months. There's a lot of disruption going on right now. A lot of firms are going to go under, and we have a different private sector we're going to need to engage, the public sector will need to engage with than exists now. Some of the bigger firms, of course, will still be there, but the small and medium enterprises, there's going to be a lot of churn. And maybe that's an opportunity to do what Walker was talking about and try to shift things more towards more nutritious, sustainable diets. So in every crisis, there are opportunities, and hopefully those can be taken. Thank you.
Alan, I've been wondering, I mean, this is a little bit related to Mauli's point, I think, about, are there going to be positive changes that come out of this? And surely one impact of the epidemic is that people will realize that they don't have to move around as much, that you can do a lot of work from home, and you don't need to travel to meetings. You can have international webinars like this without traveling. And surely that realization is going to change future behaviors, and possibly for the good. So there are many negative things about the crisis, but if we try, at least we can hopefully find some positive ones as well. I'd like to thank all the speakers. I thought this was quite an interesting session, and I saw that the president of the PAA was on for this call, Eileen Crimmins. I'd like to thank her for organizing this and making this possible. And also thanks to Cheryl for her help in setting this up, and thanks to the audience members who attended and who asked questions. It's all very much appreciated. And I wish you all a good day or evening, whichever the case may be. Thank you very much.
Thank you.